Mewing is based on the tropic premise. Lips together, teeth together, tongue on the roof of your mouth. Essentially using good oral posture to guide good growth or influence the balance of the facial structure after growth. Maintaining lip seal is an important element in this. Now, just before we dive into this, I would like to thank our generous supporters on Patreon who voted to cover this topic next. If you would like to vote on upcoming topics, see our videos a few days early, have your name credited in the videos, or thank us for helping you in any way, then please consider becoming a patron. I often view the lips as being the magnets of the mouth. I watch my patients who often struggle with lip seal. Usually I try to sneak a preview of them sitting in the waiting room and watch as they walk into the clinical room, seeing if their lips are together. Many really struggle to maintain a natural lip seal, and the treatment suffers as a result. Finally, when they achieve it at a subconscious level, it jumps the whole process forwards, and suddenly there is this improvement in lots of little areas. It's almost as if the act of achieving a natural lip seal brings everything together and makes the face bloom. I worry if I've ever achieved a really nice result without achieving it. Lots of people struggle at night. It's easy to close your lips when you think about it. It's much harder when you're asleep. I'm often asked for tips and hints to help in maintaining a lip seal at night. This is a major part of lip seal. Most of us are asleep for 30% of the time, so that it's around 1/3 of your lip posture time. Check if your mouth is dry in the morning. Ask someone to check in on you or a partner to make notes when they can. Listening to any noise can help, and apps like Sleep Cycle, Sleep Better, Sleep Tracker 24/7 or Sleep Health can all help. What is the problem? For most people, the distance from the tip of their nose to the tip of their chin is a bit too long because the face is downswung, meaning that the lips have to stretch too far to meet. To compensate, many people engage other muscle groups to bring their lips together. The classic muscle is the mentalis, the chin muscle. The classic method is to use the mentalis muscle to roll the soft tissue of the chin up and around the chin to raise the lower lip, damaging the form of the chin tip. Don't do this if you can avoid it. Lip seal should be a subconscious habit, and recruiting additional musculature to assist damages facial form and appearance. However, the first step is to gain lip seal and worry about technique more once it's achieved. Also, if you lose lip seal, the effect is similar to two magnets being pulled apart. The lips recoil apart, pulled back by the tissue, which is frequently too short in relative terms, allowing the mouth to fall open, which also brings the tongue closer to the airway, which may exacerbate snoring and sleep apnea. Gaining a natural lip seal throughout the night is very important. There's good evidence that myofunctional therapy, or mewing, can have a large influence on sleep apnea. A 50% reduction in symptoms for adults is impressive. And I would think that gaining a natural lip seal would greatly help prolong this effect long after you stop the exercises. The first step that we usually recommend is lip taping. There are two approaches. One is to physically hold the lips together. The other is to act as a subconscious reminder. Initially, I would usually recommend someone uses the tape to physically hold their lips together. There are lots of methods and lots of tapes, but simply you are taping your lips together. Most people start with lots of tape to make sure their lips are held together, closed. Once you succeed, wait a few months before you reduce the amount of tape progressively to the minimum. At this point, experiment with placing the tape so that it does not hold the lips together, but acts to tug on the skin, acting more as a reminder than a physical blockage. We've covered the lip seal tape with Dr. Frank Siemens before. It's an excellent tape. It's not going to be the cheapest tape, but it really works very well and comes under the heading of the tapes that are going to physically hold your lips together. We have the woody nose, mouth strips, breathe easy, sleep easy. These strips go around here on the face, and they're another method of helping hold your lips together, but also to remind you. And we have a Japanese product that is more discreet. It's working to hold the top, bottom to lip together in a central position. And again, this is acting more as a reminder than as a complete blockage. And many people are using small little steri-strips or sections of tape simply across the lips in small places. Again, this is as you get more used to it and you don't need such a large physical reminder to keep your lips together, you can reduce things down to a smaller and smaller and smaller amount so that you are not physically holding your lips together, but reminding you through a tug on the skin to hold your lips together. One important thing to consider is you don't necessarily need to tape the lips themselves. You can take a large length of relatively thin tape, this is micropore by 3M, and you can place it diagonally or in many different orientations, because what you're doing here is trying to build a reminder to remind you to keep your lips together. So as you gain a reasonable lip seal with probably some more heavy duty taping, gently wind back using less and less tape and try lots of different arrangements of tape. You can use tape more vertically down the face, you can use it diagonally, anywhere that's going to act as a tug on the skin as you open your lips. So here you're not doing it for yourself, you're helping remind yourself to do it yourself.